Councilmember Garcia? You probably did not hear me, my mic was off. So I'm going to hand over the proclamation to you for Mental Health Awareness Month.
Hold on 1 second, pulling it up.
Okay.
Thank you, Mayor. Whereas the theme of 2022 Mental Health Awareness Month is Together for Mental Health, and whereas mental health is defined by the World Health Organization as a state of well-being in which people can realize their own potential, cope with normal life stresses, work productively, and contribute to their community. And whereas mental illness affects everyone directly or indirectly through family, friends, or acquaintances. And whereas 1 in 5 adults in the US experience mental illness each year, including 1 in 6 youth ages 6 to 17. And whereas mental health is a significant component of overall health and should be a priority for those with and without mental health conditions. And whereas local providers, including NAVOS, Sound Health, Catholic Community Services Counseling, Recovery and Wellness Program, Institute for Family Development, Asian Counseling and Referral Service, Crisis Connections, and Evergreen Treatment Centers, REACH program, have been responding to the needs of people with mental illness in King County by working to transform the quality of life for people vulnerable to mental illness and addiction through a broad spectrum of care. And whereas the Burien City Council approved new investments in 2021 that pairs social work and mental health professionals with police and fire first responders to help people experience mental health crisis, or to help people experiencing mental health crisis. And whereas this is an opportunity to shine a spotlight on the need to strengthen our local mental health care system. Now, therefore, the City Council of Burien, Washington, does hereby ask all Burien community members to join together to proclaim May as Mental Health Awareness Month.
Thank you, Councilmember Garcia. And I see Miss Leanne Rhys-Jones is here to accept your proclamation.
Yes, hi, good evening, Mayor Aragon and Deputy Mayor Shilling and fellow council members. Yes, my name's Leanne Rhys-Jones. I'm the lead program supervisor down in Burien. Many know our program. It's a collaboration with Burien Police Department as well as our local King County and Burien prosecutors, serving clients within the community that are chronically homeless, who often do have experience or a diagnosis with mental health illness and trauma. I first just want to quickly acknowledge before I go on to that piece, the possible fear, overwhelmment, sadness, anxiety, sadness, loss that we've all individually faced throughout this COVID pandemic as individuals with our loved ones, neighbours, community members, that has affected our mental health capacity throughout the last 2 years. In our program, as I said before, we serve and support people that are chronically homeless, often cycling through in and out of mental health services and addiction services, often stemming from personal trauma or systemic trauma. And so, we try and connect them to integrate to local mental health services within Burien, but also within King County up in Seattle, where we also serve clients. As we do that, our frontline workers, we also support our frontline workers with this work because it's significantly traumatizing for them and is what we call secondary trauma. So we help our staff to look at self-care, taking a mental health day if need be, to enable them to continue the work that we do to support and serve our clients in that situation, cycling through the mental health system, but also trying to address their mental health and move forward as best they can. So yes, thank you. And I do accept the proclamation and I feel honoured to be here. So thank you.
Thank you, Ms. Rhys-Jones.